Okay. Can you hear me? Yes. Before I introduce the next panel and the moderator, I'm not going to be here this afternoon. I'm going to leave you in the safe hands of Jim to chair. You know, I had to step in because Jeff Bezos couldn't make it. They asked me, "Can you just step in?" I said, "Well, do what I can." But I will not be here this afternoon. I will see you hopefully at the dinner tonight, and then Jim will continue. So the next panel, as I promised, is about digital health. Is moderated by Eileen Tangal, Managing Director of In-Q-Tel, and she also will be chairing tomorrow's session. So please welcome Eileen. Thank you. Thank you. See you.
Good afternoon, everyone. My name is Eileen Tangal, and I am a Managing Director of the London office of In-Q-Tel. As Ignacio said, I will be chairing tomorrow. But today, right now, I'd like to introduce you to Dr. Tara Bishop. I've known Dr. Bishop for almost 30 years when we were at university together, when we were 10 years old. She has a really impressive career since we went to university together. She's trained as a physician. Are there any actually medical doctors here? So we just have the one here. So don't overwhelm her if you're not feeling well. But anyway, so Tara trained as a physician at Cornell. She is a fellow at Mount Sinai Hospital. She's a professor of healthcare policy at Cornell. She was McKinsey's top consultant in medicine. And then most recently, she was chief medical officer of Bind on Demand, which had a significant corporate venture capitalist, United Healthcare, as an investor. And United Healthcare ended up acquiring Bind on Demand. So she's got the perspective from being an entrepreneur, working with a CVC, who ultimately acquired the company she was at. And today she's with us representing Black Opal Partners, and I'm going to let her tell us about who Black Opal is, as well as really answer some of the same questions that Dr. Rana answered previously. So Tara, could you please just tell us a little bit more about Black Opal?
Absolutely. And can you guys hear me okay? Yep. So thank you, first of all, for the invitation to speak today. As Eileen said, I've had a pretty diverse career in healthcare and started out very much in academia in a traditional sense of research, teaching, patient care in a health system. Had an opportunity to then move to the consulting world and work with large corporations across the board, multiple government agencies and elsewhere with a global consulting company, and then most recently from the ground up, an early space startup that ended up growing and being acquired by a corporate investor that was a key partner in our company. And taking that experience, I'm actually launching a new fund that is focusing on digital healthcare. I'm very happy to share my experiences and my perspectives on where digital healthcare is now and where we see it in the future. But this fund is investing in digital healthcare from the health services perspective, life sciences perspective, and device and diagnostics. And we see tremendous opportunity in this area. Happy to share some perspectives on that.
And maybe you could share, it's being backed by a...
Yes, and so we do have a cornerstone investment by a large pharmaceutical company. We will be investing in both the U.S. and in Europe and the UK and a few other global companies as we see opportunities.
Great. So just starting with that, could you just tell us a little bit more about your perspective on the digital health landscape globally?
So digital health is, it is a massive and growing area. As Dr. Rana mentioned in her talk, it's almost overwhelming to start to think about the opportunity in digital healthcare. And I actually want to take everyone back to, I've been working in this industry for the last 20 years. If I look back to 20 years ago when I was an intern at Mount Sinai Hospital in New York City, this is what it was. We had paper charts. We would spend half of our day running around to try and find a paper chart, try to run down and find if we could get a lab result back, knock on doors to chat with the radiologist. And if you think about it, it's only 20 years ago when we were actually living in that kind of environment in healthcare. If you fast forward to today, we now have electronic records, which are ubiquitous not just in the United States healthcare system, but very much in other developed countries, in the UK and Europe, very much broadly globally. We now have lots of technology to be able to deliver care very differently, thinking about remote care, telemedicine. We now have things like an Apple Watch that we are all wearing, or many of us are wearing, that can actually monitor our heart rate, potentially do a 6-lead EKG on us. And similarly, we're also seeing evolution in the way pharmaceuticals are being developed and even delivered. The idea of perhaps treating an illness with a digital therapeutic rather than a traditional pharmaceutical is really different than how it was when I started my career in medicine. And so it's an incredibly exciting time for digital healthcare. I think it's tremendously transforming the industry, tremendously transforming the way we deliver healthcare, but also the way we personalize medicine and think about that real opportunity to deliver the right care to the right patient at the right time, at better value, at lower cost, better quality. So there's tremendous opportunity. It's also a time of almost an overwhelming amount of innovation happening. And Dr. Rana mentioned this, the number of companies that come to us with a solution. I have a solution to solve the care for autoimmune disorders. There's now multiple companies coming around. There's multiple companies that want to get into this ecosystem. And as much as there's opportunity, there's also a need to think about how do you actually think about the go-to-market strategy. If you are developing a new solution, one of the challenges is to think about how do you actually sell to a health system and develop that value proposition for a health system to want to buy your product, or a payer, or a pharmaceutical company. And I think that's going to become the critical question of how do you derive value for the end user or the end customer to actually make you a differentiated product in the market. Again, because there is a lot happening in this area.
So just riffing on that, now that COVID has really impacted probably yourself, your patients, the whole industry, how do you see the digital health industry post-COVID, and how is it going to evolve?
So COVID has been, I think of it as not just the most transformative pandemic in my lifetime, but perhaps the most transformative experience in healthcare generally. And I actually reflect back to, in 2012, I published a study with my team at Cornell in a journal called Health Affairs, where we were actually looking to determine how much remote care could happen and how much telemedicine was happening at that time. So you think about that, that's about 8-9 years ago. And one of my co-authors and I would talk about this, and we'd say, if I was a young mother and I had to take my kid to the pediatrician, that meant taking off half a day of work, getting the appointment, getting them over there, figuring out babysitting, all sorts of things to try and get my child to the pediatrician. How great would it be if we didn't have to do that? So 8 years ago, we decided we wanted to study this and think about, was the market ready for this kind of care? What we found was it was on almost no one's radar. Mayo Clinic was doing a little bit of a pilot where they were trying to do some remote care. There were a few clinics here and there, but no major health system was even thinking about this. No payers were thinking about how you might actually incorporate this into your product. And it was just not on people's radars. And even fast forward pre-pandemic in 2019, if you asked me whether companies like Teladoc, Amwell, Roe, even those direct-to-consumer companies would have this kind of market share, I would have said, well, they're kind of fringe. No one really wants to do a Teladoc visit, a telehealth visit with someone they don't know. None of the health systems are really doubling down on this. And then the pandemic hit, and it completely, almost within days, completely transformed the industry. There are studies that came out of Harvard, that came out of Stanford, that actually showed that their volume of in-person visits dropped by about 90%, and their volume of telehealth visits increased by about 90%. And in addition to that, companies that were in this place or innovating in this space actually started to get much more market share. So I think of the pandemic again as one of the greatest accelerators of digital health and remote care, telemedicine that I have seen in my career, and I think will be largely seen as one of the major trend drivers in this area.
So you mentioned that sometimes there's a lot of tech for tech's sake, or sort of boys with toys kind of as an expression of I have this cool widget, but it doesn't actually help anybody. So what are some of the other challenges that you've seen when these startups come to you and say, hey, I want to sell to Mount Sinai, and how do they get over them?
Yeah, that's a great question. And I think one of the key factors when we think about whether an innovation can get into the market, get to sale, actually evolve into a real company is again that kind of go-to-market strategy. And I think one of the critical questions, and I take this actually from a bit of a U.S. perspective, because we have probably the most complicated healthcare system, which offers both challenges and opportunity, but there's equivalence in every health system. Is really the value to the end user or the end customer. This is one of the key questions when we think about exciting new technology. I think about, for example, the Apple Watch. Exciting new technology, fascinating to think that you could actually do real diagnostics from a device that's sitting on your wrist. But if you put on the hat of someone who is a physician or is a cardiologist, someone who's actually caring for a patient, how do you incorporate that kind of data into your model, and how do you get paid for that kind of care? How do you monitor someone when your office is not open 24 hours a day and 7 days a week? And so this idea of actually what is the value for an end customer is a critical question that companies have to think about. Whether you're developing a technology, whether you're developing a services company, and in fact, are there services that you have to wrap around technology to actually get it into market? So that's actually something that we see a lot of, that technology sometimes standalone doesn't always solve everything. Eventually, we do hope there will be more movement to technology, but right now we're still in an ecosystem where services play a critical role in the healthcare ecosystem.
Great. Now, so if I could talk about your experience at Vine On Demand, and maybe you can just explain what they did, where you had, at the very early stage, United Healthcare, a corporate VC involved, and you were chief medical officer, correct? And then after that, they bought you, right? So I think the stat, and Jim, correct me if I'm wrong, is it's only something like 10% of the actual corporate VCs that buy the company. So you're one of a few. Could you tell us, was that a good experience? What was it like working with a corporate VC? What was good, what was bad?
Yeah, great question, and happy to share some perspectives putting on a startup executive hat. So just to give you a little bit of background on the company that I joined in 2018, we were a new health insurance company based in the United States that was selling a product to the commercial market. So, and one of the differentiators of the product was really the fact that we were designing a brand new way of coverage that was more dynamic than what was available on the market, much more personalized, and the idea was that you could know before you walked in the door how much something would cost you, and the cost of that thing would be actually aligned with the value of the services. So a very complex insurance model that we had to do a lot of building on, but we wanted to make it very simple and easy for the end user, anyone going in to get healthcare services. I joined the company when we were about 30 people, and we were pre-Series A, had not really launched a product yet. We rolled up our sleeves and started building, and then were able to get a product going for some marquee clients in 2019 when we launched the product. And at that time, United Healthcare did become an investor in the company in our Series A round. So we had a large corporate that was aligned with the company. And I think there was tremendous value of having that corporate partnership. I would say there's a few things that really, probably 2 or 3 things that stand out in my mind were the fact that we were given tools and resources that allowed us to actually innovate much faster. One of the key things that we were actually offered with that partnership with United Healthcare was access to their network of physicians. If anyone is in the insurance industry, building a network of physicians and contracting with hospitals and doctors is a tremendous load. And it's actually one of the reasons why many health insurance companies have to start in very, very small markets and choose a market that actually allows them to contract or narrow their networks in order to contract. United, with that partnership, allowed us to actually offer the product across the entire ecosystem of the US and to customers that had employees across the United States. So having that tool was tremendous. The second was actually access to data. So we were able to access data that we couldn't have amalgamated ourselves. And so having that access to data allowed us to actually develop the product at a much faster pace. So again, those tools and resources were critical. I would say the other thing is really the credibility. So we were a new insurance company. No one knew who we were. We were going to Fortune 500 companies, smaller companies, and saying we could actually do this. We could offer health insurance to your employees. If you think about, if you put on a benefit manager's hat and someone comes in to try and sell you this, it's very daunting to say, yes, I'm going to take a leap and I'm going to have an employee actually take this brand new health insurance and offer it to my employees. United allowed us to give some credibility, both in the sales cycle and in just having that sort of reputation that we had sort of the backing by a large company. We ended up growing at a tremendous rate, faster than actually many of the health insurance companies that some of which have gone public recently, but many of the health insurance companies at the time. United, I think, recognized that there was an opportunity for them to grow their business by acquiring the company. And because we had that corporate relationship, decided that they wanted to incorporate the company into their business. And so I actually left at the time, shortly after the acquisition, and am kind of now observing how that actually works and how the acquisition is going, both through colleagues and friends who are still at the company. But again, I think about sort of that 3-year trajectory of how we were able to grow, and it was really through the corporate partnership of United. I don't think we could have done it without that partnership.
Great. And so now that you have Black Opal and you have backing from a large pharmaceutical and are going after the next wave of digital health, can you tell us a little bit more about, what are you most excited about? What are you going to invest in next?
So lots of exciting stuff to think about. I think there's a few things that really stand out in my mind about the future of digital healthcare. If you think about a few things that have been big disruptors in the industry, but also how much opportunity there is to further that disruption. And the two that come to mind are electronic health records and telemedicine. So both of these electronic health records were a major disruptor about 10 years ago in the United States, and actually very much globally, maybe around that time in the 2010s. Telemedicine, I would say, is disrupting brick and mortar healthcare now. So we're talking about two evolutions of technology that are substantial disruptors of traditional ways that we've delivered or recorded healthcare. But in many ways, what the initial technologies have done is taken sort of what we did in person or what we did on pen and paper and just transform that into a similar but digital way of doing it, right? So if I think about doing a telemedicine visit, it's really doing it in a very similar way that I might have done when I was sitting with a patient next to me, but now doing it with a video screen. And I think that's sort of the version 1 of what we're seeing digital healthcare to be. I think there's a lot of potential for enabling technologies to actually transform how we actually deliver that care. So one example is artificial intelligence, to think about how do we make better decisions? How do we augment the way a doctor thinks about making a decision? How do we use the data that's coming in to perhaps give a personalized recommendation that can get signed off by a doctor, or even given to a patient with some sort of educational component, so that we're moving away from just kind of delivering care, taking what was in person and just transforming it to virtual, but actually moving the needle to create more personalized, more efficient care. I think about the potential for massive amounts of data. We are collecting data from rings, from watches, from monitors, and we're learning a lot about what people do outside of being inside a health system. I used to see patients, and if I was seeing someone who had a chronic illness, I saw them 4 times a year. I had no idea what was happening outside of the office and inside their home. And I think these enabling technologies to help us understand more about the patient and what is happening in their lives is going to be a tremendous opportunity for pushing the needle in terms of understanding how we, again, get to more personalized, better care, more efficient, more safe care. And I think the other thing is that is the opportunity to actually start to get these technologies, get these new ways of both delivering care, treating illness, diagnosing to more people. I think we are going to start to see that some technologies will start to be commoditized. I was actually speaking with a company that said, we're developing natural language understanding that's much more nuanced than what was existing today, because natural language processing is becoming very commoditized, right? And if you think about places like more developing countries, more rural areas where there may be disparities in care, there is tremendous opportunity to start to get these technologies to more people, and again, get to that ultimate goal of better health care for all in a more efficient, more valuable way.
Well, great. With that, we will wrap up, but thank you so much, Tara.
Thank you.
And I hope you all enjoyed that, and please come find Tara later. Any questions? Thanks.